You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. This week, let's talk about vitamin D. Let's talk about gums and teeth. You guessed it. This week, we're going to talk about vitamin D and its incredible role on the oral cavity. Now, we learned in hygiene school about vitamin D. We learned, for example, that vitamin D is a fat-soluble vitamin, and it is naturally present in a few foods or can be added to others. We also can absorb it endogenously when ultraviolet light from the sun hits our skin and then triggers vitamin D synthesis. We learned that vitamin D promotes calcium absorption in the gut, and it's a critical component to normal bone mineralization. It's needed for bone growth and bone remodeling by osteoblasts and osteoclasts. And without sufficient amounts of vitamin D, our bones can become thin, brittle, or even misshapen. We see this in some cases of vitamin D insufficiency, like rickets in children or osteomalacia in adults. And we know that together with calcium, vitamin D can help to protect aging adults from osteoporosis. But vitamin D also has other roles in the body, things like the reduction of inflammation, as well as supporting important processes in the body like cell growth, neuromuscular and immune function, and glucose metabolism. So, how does vitamin D influence or impact periodontitis? Well, sufficient amounts of vitamin D can dramatically decrease the risk of our patients experiencing gingivitis and chronic periodontitis. Sufficient amounts of vitamin D have been shown to provide immunomodulatory components, which essentially means it offers changes in the body's immune system, optimizing and elevating immune function. It also supports anti-inflammatory components, anti-proliferative effects, like suppressing cell growth, particularly spreading cells that can cause disease, and it initiates cell apoptosis, which is basically cell death of unneeded or abnormal cells. Put simply, the use of vitamin D allows the body to elevate its immune system and target and attack funky, unneeded, or abnormal cells that shouldn't be within the periodontium. In addition, vitamin D, we know, is important for bone metabolism, particularly in alveolar bone, and therefore is critical in the prevention of tooth loss. Vitamin D also increases antibacterial defense of our gingival cells. It decreases inflammation in the gingiva. It improves post-operative wound healing following periodontal surgery, and has been named an important supplement used as a prophylactic agent in periodontology. And so, vitamin D, although important for bone health, also provides incredible support for patients who may be at risk for gingivitis or who are healing from periodontal treatment. Stay tuned next week as we continue the conversation around fast facts in periodontitis. This has been another episode of Fast Facts Perio Edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.